let's get some pointers for our conversation. 8 minutes after 7. Janet Davis is Chief Executive and General Secretary of the Royal College of Nursing, and as I recall, Janet Davis, you put together a fairly powerful petition that was part of this, didn't you? Good morning to you.
Good morning. Yes, we did. Our nurses are really getting quite despondent and angry about this. It's been many, many years now since they've seen any sort of cost of living pay rise. And it's beginning to squeeze them, but more importantly for us, it's beginning to affect safe staffing in our hospitals and our communities. We've got 40,000 nursing vacancies in England alone. And this is a real sign that, nurses are not feeling valued. They're voting with their feet. They're choosing to work for agencies, and of course, that's really expensive for the health service if they're having to always try and fill these vacancies, having to use expensive agencies, despite the fact that's not what anybody wants. But actually, people are having to work there to make ends meet now. It's a real struggle for nurses.
I recall during the general election campaign the suggestion, I don't know if it was ever verified, that nurses were having to use food banks. Do you know if that is the case, Janet Davis?
Which is absolutely true. And we have a number of cases we know of ourselves. We have, as part of our organisation, we have a charity. We have a call centre and a line for nurses in trouble. The calls to that have really peaked far more than ever before. And amongst those people that we're giving benefits to ourselves, to actually giving handouts to actually help them pay their bills because they're in a time of crisis. And we know quite a number of those people have resorted to food banks to feed their children.
The line that seems to be coming out of number 11 from the Chancellor is, to use the words of former famous Conservative leader, "We can't spend what you don't earn." How would you react to that?
Well, it's what value we put on health service. It's about what value we put on the health of our population. Without nurses, without doctors, without other healthcare professionals, there is no national health service. And at the moment, we're really struggling. It's a political decision on how much we actually put into our health services, and that includes paying a fair wage for the staff who deliver that service.
Stay on the line if you would, Janet Davis. I want to bring someone else into the conversation at 11 after 7. Listening to that, Jonathan Davis, who's an economist and wealth advisor. Do you buy the line coming out of number 11, or should there be perhaps a slight loosening of the purse strings? Morning to you.
Good morning. A loosening of the purse strings. I mean, the idea that we have tight purse strings the last several years is a myth created largely, I think, by the media. Government spending since this apparent 2010, when apparently austerity started, government spending has risen every single year. And yet every day we hear about austerity. How can you have austerity when government spending rises every year? And secondly, this thing about public sector workers under the cosh, I don't get it. There's been big tax falls, and on top of that, the cost of mortgages plummeted way back in 2009. Actually, public sector workers have more money in their pockets than they did several years ago.
Why would they then be going to food banks, Mr. Davis?
Well, political food banks to me is a political thing. You go along to your GP and you talk about money, you're immediately sent to the food bank. I'm sure there are some cases where it is a need, but no, the bulk of cases, no. I hear too many anecdotes. People are just taking it for a ride.
So you don't buy the story or the suggestion that there are teachers who are in desperate need of pay rises, there are nurses and other staff who are effectively bouncing along the bottom?
I don't get that. As I repeat, it's very important. There's been big tax falls, and on top of that, the cost of mortgages plummeted several years ago.
Let's put that then. Let's bring Janet Davis. I imagine you'd have some reactions to... I assume you two aren't related, by the way. Janet Davis, I imagine you've got some reaction to Jonathan Davis. Go ahead.
Family discussions, I think.
How do you respond to that?
Well, we've done the work ourselves. We can see our nurses' pay packets. We can see the cost of living. In the last 10 years, a staff nurse's salary has gone down in real terms by 14%. So it's not actually a valid argument. We also know their rents have gone up. Yes, some nurses have mortgages, many have rents. It's quite hard to get on the housing market for a nurse. Their rents have gone up. Their cost of childcare have gone up. Their contributions to their pension have gone up. The cost of food has gone up. Inflation is way above every year what a nurse is getting. And actually, before the 1%, there were a couple of years where they had nothing. And at the beginning, with the banking crisis, I think everybody understood we were in hard times. that, this is too long that this has gone on for, and people are struggling. And what we are seeing, the reality of this, is we have 40,000 nurses less than we need in the NHS in England. So, if this was the free market, then we'd be looking at how much can we pay people to get them into these roles we so desperately need.
Final word to you, Jonathan Davis.
The solution is never to have wage inflation and general inflation. Miss Davis there puts the finger rightly nail on the head. Inflation is the problem. So what we need is deflation. The Bank of England, Mark Carney, before Mervyn King, slashed interest rates and kept them lower for far too long. That is the reason why the pound has gone down. That's the reason why import costs have gone up. Therefore, we have inflation. The solution is not to build more inflation, because that will create even more inequality and difficulty. The solution is to raise interest rates and thus create inflation. Thus, the cost of living will go down and living standards will go up.
I will leave it there. Thank you to Jonathan Davis, economist and wealth advisor, and you heard first from Janet Davis, no relation, Chief Executive and General Secretary at the Royal College of Nursing. So the reality nurses out there on the food banks, or in fact, perhaps they're not handling their budgets well enough, as my other guest suggested.